Hi everyone, welcome back to the Dr. Sia channel. In the video here today, we're going to be talking about ambivalent attachment and the main story that goes on in the mind of a person with ambivalent attachment. We call this a narrative. Let's get started. Alright, so what is that main narrative or story that goes on in the mind of a person with ambivalent attachment? If you can spot this, if you can know what this narrative is, it will help people around you who are ambivalent. It will help your patients. You can better help your partner. You can better help your friend. You can better help your sister, brother, mother, father, whoever you're looking to help. You can better help yourself if you know this. So this, what I'm about to present, is the most truthful or most reliable and most consistent narrative that I have found throughout my many years of reading and studying and working and so on and so forth about the person with an ambivalent attachment. And that is this: I can't help me at all. I can't do really anything much for me, but everyone else can do a lot more for me. I can never really be enough for people just by myself, but the things that I do for them can be really useful and beneficial. I, when all by myself and all alone, am vulnerable and hurtable. So these are the three main narratives that I have found are consistent. So let me describe each and every one of them. So first of all, I can't help me, meaning the person with ambivalent attachment has never really been regulated as a child. They've never really been explained to, told, taught how to regulate themselves, how independently help themselves. Now, because they haven't done that, they believe that the only way that they can be regulated is by other people, meaning that they're kind of dependent on another person to regulate them instead of themselves. Then they have this idea that there's really nothing to them, because for many times, or very often, the person with an ambivalent attachment has never really been given attention to. Not attention for themselves as a genuine person, rather for what they can do, what they can achieve, how they can contribute to the family system, as opposed to who they are as a person. Now this leaves the person often thinking that there's nothing in there, that there's no person in there, there's no one really in there to connect to. Instead, they become reliant on what they can do for people, how they can be useful and nice and kind and so on and so forth, funny, rather than expecting that anyone is ever going to want to be with them, genuinely connect with them, and not abandon them. Finally, they believe that being alone means they are vulnerable. So opposite to avoidant attachment, where they believe that being with others means vulnerability, for the person who has an ambivalent attachment, they believe that loneliness means vulnerability. They believe that if they are all alone by themselves in an apartment watching TV, that they are somehow more emotionally vulnerable than if there was 1, 2, 3, 10, 50 people there possibly. Now, what this does and what this means is that because the person with an ambivalent attachment has never, going back to point number 1, learned to soothe themselves, but also when other people are not there, it's almost like they are confronted with the destitute, with the isolation, with the, no, not isolation, with the nothingness of their own personality. Like as though in by themselves, if it was just them, it's like there's nothing there. And that is a scary, vulnerable feeling in and of itself. I hope you enjoyed learning about these three main kind of points of narratives that go on for the person with ambivalent attachment. Perhaps you have some that you would like to add. Please write them down in the comments down below. Please, if you do like my videos, do like the videos, because it helps my videos get more exposure and more people to see my videos. I hope you enjoyed this one, and I'll see you again for the next one.